How to get off type 2 diabetes medication, -4 proven steps. Not everyone with diabetes needs medication, but many people rely on insulin or oral drugs to manage their condition. But what if I told you there's a way to potentially reduce or even eliminate your need for medication? If you have type 2 diabetes, you've likely asked yourself, is it possible to get off medication while still keeping my blood sugar under control? That's exactly what we're going to explore today. Welcome to Boundless Health, where we share science-backed strategies to help you understand, manage, and take control of your diabetes. Before we begin, make sure to subscribe and turn on notifications so you never miss an important update. Now, let's get one thing clear. This video is not medical advice, and I am not telling you to stop taking your medication. Do not throw away your prescriptions after watching this. That is not the point of this video. Always consult your doctor or diabetes care team before making any changes to your treatment plan. Now that we've got that out of the way, let's get started. Important considerations about medication use. Before we dive into the details of how to reduce or eliminate medication, there is something critical you need to understand. This video is not medical advice, and I am not telling you to stop taking your medication. If you are currently on diabetes medication, do not suddenly stop taking it. Doing so could be dangerous and lead to serious complications. Always consult your doctor or diabetes care team before making any changes to your treatment plan. Medications are prescribed for a reason. They help keep blood sugar levels stable, prevent complications, and support overall health. However, for some people, with the right lifestyle changes and careful medical supervision, it may be possible to gradually reduce medication dependency. The key here is gradual change, done in partnership with your healthcare provider. Now that we have clarified this important point, let's move forward and explore why medications are prescribed in the first place. Why are medications prescribed for type 2 diabetes? To understand how some people may reduce their reliance on medication, we first need to look at why these medications are prescribed in the first place. Type 2 diabetes is a chronic condition that affects how the body processes insulin. In a healthy body, insulin acts like a key that allows glucose to enter cells and be used for energy. However, in type 2 diabetes, the body does not use insulin properly, insulin resistance. The pancreas does not produce enough insulin to keep blood sugar levels stable. As a result, blood sugar levels rise too high, leading to potential long-term complications such as nerve damage, kidney disease, heart problems. To help control blood sugar and prevent complications, doctors prescribe medications such as metformin, which helps lower glucose production in the liver and improves insulin sensitivity. Insulin therapy, which helps regulate blood sugar when the body cannot produce enough on its own. But here is the good news. For some people, with the right lifestyle changes including diet, exercise, weight management, and stress reduction, it may be possible to reduce or even eliminate the need for medication over time. The key word here is possible. Not everyone will be able to stop taking their medication, and that is okay. The goal is not just to remove medication, but to manage diabetes effectively and improve overall health. So, where do we start? The first step is addressing the root cause of type 2 diabetes. Insulin resistance. Let's take a closer look. Understanding insulin resistance. To successfully reduce or eliminate the need for medication, we must address the root cause of type 2 diabetes, insulin resistance. But what exactly is insulin resistance? Think of insulin as a key that unlocks the door to your cells, allowing glucose, sugar, to enter and be used for energy. When your body is insulin resistant, that key stops working properly. The cells do not respond well to insulin, making it harder for glucose to enter. As a result, blood sugar levels rise. To compensate, the pancreas produces more insulin to try and bring blood sugar levels back to normal. Over time, this overworks the pancreas, leading to chronic high blood sugar, prediabetes, eventually, type 2 diabetes. What causes insulin resistance? Several factors contribute to insulin resistance, including excess weight and belly fat. Fat cells, particularly around the abdomen, release inflammatory chemicals that interfere with insulin's ability to function. This inflammation makes insulin resistance worse over time. Lack of physical activity. Regular movement helps the body use insulin more effectively. A sedentary lifestyle makes cells less responsive to insulin, causing blood sugar to rise. Unhealthy diet. A diet high in processed carbohydrates, added sugars, and unhealthy fats contributes to insulin resistance. Excess sugar and refined grains cause frequent blood sugar spikes, leading to increased insulin production and eventually insulin resistance. Genetics and family history. If diabetes runs in your family, you may be at higher risk of developing insulin resistance. However, lifestyle changes can still make a significant impact, even with a genetic predisposition. Chronic stress and poor sleep. High stress increases cortisol levels, which can worsen insulin resistance. Lack of sleep disrupts hormones that regulate hunger and insulin sensitivity, making blood sugar control more difficult. Common symptoms of insulin resistance. Many people have insulin resistance for years before they are diagnosed with type 2 diabetes. Here are some signs to watch for. Constant fatigue, especially after meals. Frequent cravings for carbohydrates or sugar. Weight gain, particularly around the belly. Dark patches on the neck or armpits. A condition called acanthosis nigricans. Increased hunger, even after eating. If you experience these symptoms, it is important to take action early. Now that we understand insulin resistance, let's discuss the 4 key lifestyle changes that can help improve insulin sensitivity and reduce the need for medication. How to get off type 2 diabetes medication. For simple steps, now that we understand insulin resistance, the next question is, how can we improve insulin sensitivity and reduce the need for medication? The answer lies in 4 essential lifestyle changes that help the body naturally regulate blood sugar. Let's break them down step by step. 1. Focus on a diabetes-friendly diet. What you eat plays a crucial role in blood sugar control. A balanced whole food diet can significantly improve insulin sensitivity. Here's how to structure your meals. Reduce refined carbohydrates and sugars. Swap white rice for brown rice, quinoa, or millet. Replace sugary snacks with nuts, seeds, or Greek yogurt. Increase fiber-rich foods. Leafy greens, beans, and whole grains slow down sugar absorption and keep you full longer. Eat healthy fats and proteins. Add avocados, nuts, fish, and lean meats to stabilize blood sugar. Practice portion control. Even healthy foods can cause blood sugar spikes if eaten in large amounts. For example, if you love rice, reduce the portion size and add more vegetables and protein to balance your meal. A diet focused on whole, unprocessed foods supports better blood sugar regulation and reduces the body's reliance on medication. 2. Exercise regularly. Physical activity is a powerful tool in reversing insulin resistance. Exercise helps the muscles absorb glucose more efficiently, which lowers blood sugar levels. You don't have to run marathon small. Consistent changes make a big difference. Here's how to get started. Walk for 30 minutes, 5 times a week. Incorporate strength training using light weights or bodyweight exercises. Find an activity you enjoy. Swimming, dancing, yoga, or biking. One of my patients started with just a 10-minute walk after meals, and within weeks, her blood sugar levels improved significantly. 3. Manage your weight. Losing just 5 to 10% of your body weight can dramatically improve insulin sensitivity. For example, if you weigh 90 kilograms, that means losing 4.5 to 9 kilograms can help lower blood sugar naturally. The key is to focus on long-term, sustainable weight loss, not crash diets or extreme restrictions. By combining a balanced diet with regular exercise, weight loss happens naturally, making it easier to reduce medication dependency over time. 4. Reduce stress. Stress plays a bigger role in blood sugar control than most people realize. When the body is under stress, it releases cortisol, a hormone that raises blood sugar and increases insulin resistance. Here's how to manage stress effectively. Practice deep breathing or meditation for a few minutes each day. Engage in activities you enjoy to relax your mind and body. Make time for family and friends, as social support helps reduce stress hormones. Prioritize sleep, as poor sleep increases insulin resistance. Aim for 7 to 9 hours per night. Managing stress is just as important as diet and exercise in improving insulin sensitivity and reducing the need for medication. The next step, monitoring progress. Now that you have these 4 steps, the next key action is tracking your blood sugar levels and working closely with your doctor. Let's discuss how to monitor your progress and safely adjust medication with medical supervision. Monitoring progress and adjusting medication safely. Now that you're making lifestyle changes, it's crucial to track your progress to see how your body responds. The goal is to improve blood sugar levels consistently so that your doctor can safely adjust your medication over time. How to monitor your blood sugar effectively. Keeping track of your blood sugar levels allows you to understand what works and what doesn't. Here's how to do it. Check your blood sugar regularly. Follow your doctor's recommended testing schedule. Keep a journal. Write down your blood sugar readings, meals, and physical activity. Notice patterns. See how different foods, exercise, and stress levels affect your numbers. For example, If your morning blood sugar is always high, you may need to adjust your dinner choices or your evening activity level. The more data you collect, the better decisions you can make. Working with your doctor to reduce medication. Reducing medication should never be done alone. Always consult your doctor or diabetes care team before making any changes. If your blood sugar levels improve consistently, your doctor may decide to lower your medication dosage, reduce the number of medications you take, switch you to a milder treatment plan. For example, some people who maintain an HbA1c level below 6.5% for several months may have their metformin dose lowered or even discontinued. However, every person is different. Factors like genetics, how long you've had diabetes, and other health conditions play a role in determining whether you can safely reduce medication. Why stopping medication too soon is dangerous. Some people make the mistake of stopping their medication too soon, assuming that their blood sugar is stable. This can be dangerous because blood sugar levels can spike unexpectedly. Diabetes complications can develop silently, without noticeable symptoms. Stopping medication without supervision can lead to severe health risks. The safest way to reduce medication is to work step by step with your healthcare provider while continuing healthy lifestyle changes. The big picture. The goal is not just to stop taking medication, it's to manage diabetes effectively and improve your overall health. By making gradual, sustainable lifestyle changes and monitoring your progress, you can create long-term improvements in your blood sugar control. Now, let's wrap up everything we've learned and talk about what this means for your journey. Patient story. A real-life example. Let me share the story of one of my patients who successfully reduced her diabetes medication through small, consistent lifestyle changes. She was 50 years old, had been living with type 2 diabetes for over a decade, and was taking metformin daily to control her blood sugar. At first, she felt overwhelmed by the idea of changing her lifestyle, but she decided to start small. Here's what she did. She switched to a low-carb, high-fiber diet, replacing white rice and bread with whole grains and leafy greens. She started walking for just 20 minutes every evening after dinner. Over the course of 6 months, she lost 8 kilograms through gradual, sustainable changes. The results: her blood sugar levels stabilized, and she no longer experienced frequent spikes. Her doctor reduced her metformin dosage by half. She felt more energetic, healthier, and in control of her diabetes. Her journey wasn't about perfection, it was about commitment and consistency. And that's the key takeaway. You don't have to make drastic changes overnight. Small, sustainable steps lead to big results. We've now covered some of the most effective ways to manage blood sugar, from meal timing to smart food choices. But how do you put it all together for long-term success? Let's wrap it up with some final thoughts and key takeaways. Final thoughts and call to action. The reality is that not everyone can nor should completely stop taking diabetes medication, and that's perfectly okay. Each person's journey is unique. Factors like genetics, how long you've had diabetes, and other health conditions all play a role in how your body responds. But here's what you can control: the food you eat, how active you are, how you manage your weight, how well you handle stress. By making small, sustainable lifestyle changes, you can improve your blood sugar control and potentially reduce your reliance on medication under the guidance of your doctor. Key takeaways from this video. A diabetes-friendly diet helps regulate blood sugar naturally. Regular exercise improves insulin sensitivity. Managing weight significantly reduces insulin resistance. Reducing stress and getting quality sleep helps stabilize blood sugar levels. It's not about being perfect, it's about being consistent. If you are ready to take control of your health, start with just one small change today. Swap a processed meal for a whole food option. Go for a short walk after eating. Prioritize getting enough sleep tonight. Every small step matters. If you found this video helpful, make sure to like, share, and subscribe to Boundless Health for more science-backed tips on managing type 2 diabetes. Leave a comment below and let us know what's one lifestyle change you're working on right now. And remember, you are not alone in this journey. We're here to support you every step of the way. Check out the next videos on the screen for more ways to take control of your health. Thanks for watching, and see you next video.